Now, I know this is a growing problem in nursing homes and facilities. So, how would you advise a caregiver in a facility to handle an issue like this?
Yeah, and typically here we're not talking about romantic relationships as much as we are sexual behaviors, some of which might be appropriate and some inappropriate. In the case of appropriate behaviors, let's say such as masturbation, facilities are well aware that they're mandated to allow their clients and residents the full spectrum of human existence. So those provisions must be made in terms of privacy and allowances for that. But beyond that, when those behaviors start occurring in public and becoming inappropriate, then it's a whole new set of problems to contend with. And the typical way of approaching behaviors in general with dementia, and the sexual behavior should be included in that, is number one, to rule out medical problems. That sometimes a change in behavior, even sexual, can be generated by an infection or some sort of medical problem that hasn't been uncovered. Sometimes even a medication like antidepressants can rev people up and make them kind of manicky and sexually inappropriate. Number two is to assess the environment, and is the staff patient interactions appropriate? Are they challenging the patient appropriately environmentally, or are they provoking the patient? Is there another resident that's provoking the patient? Is it too stimulating or not stimulating enough in terms of other kinds of more appropriate activities? And the third area is the consideration for medication treatment if the inappropriate behavior becomes bad enough in the first two areas that have been addressed are not working. And that can range from a variety of medications to help stabilize the mood to hormonal therapy. And it's typically for all problems in dementia, the last thing you want to do, but sometimes medications can be very useful in helping with inappropriate sexual behaviors as well.